Hello. Hello and welcome to the live stream where we're talking about the ongoing pandemic and life herein. I'm James Hamblin. I'm a staff writer at The Atlantic. I'm also a preventive medicine doctor, and I'm noting the time here, 6 p.m. Eastern Time, Tuesday, March 17th, 2020. As you know, the situation is evolving rapidly and things will change. So what I'm saying right now is as accurate as I can be in the current moment. I'm going to do my best to engage with as many questions as possible in this brief stream, and you can drop those in the live chat. A couple orders of business in case you have been somehow unable to follow all of the global news, which is unfolding so rapidly that even I can barely keep up. So President Trump declared a national emergency on Friday, and that has sort of become very recently an all-hands-on-deck effort, mobilizing governments and private companies, trying to rapidly increase social distancing and testing, but we are still far, far behind on testing capacity compared to many other countries, and that's a complex story which you can read all about at theatlantic.com, and my colleagues have done great work reporting on. So there are something like 5,000 known cases diagnosed in the US, but there are certainly far more. We don't know the exact number because we don't have great testing capacity. We know we're mostly testing people who are extremely symptomatic and seem like high risk, like clinically they look like they have this disease, and not really testing people with mild symptoms or who are asymptomatic. But so that number will expand and rise as testing capacity does, and that's to be expected. On Sunday, CDC recommended that events greater than 50 people in attendance were put off by 8 weeks. In the last basically 2 weeks, it seems like almost every major event has been canceled, and the allowable group sizes are getting smaller and smaller, and people in San Francisco have been ordered to shelter in place, and the same is expected to happen in New York very shortly. Details to come. Today, I have read that Kevin Durant reportedly tested positive, adding him to a list of celebrities that would include Tom Hanks and Idris Elba, and that Facebook is giving 45,000 employees $1,000 each just to help cope with this. Complex economic stimulus bills being debated and being passed and being supported in interesting and anomalous bipartisan ways. States have closed gyms and movie theaters, and this all comes as basically everyone is adjusting to a new way of life. So obviously no one can keep up with every single aspect of this. Everyone is affected in some way. Everyone is asking me questions in my personal life, as well as just writing to me as a journalist. And so I wanted to take this opportunity to possibly answer some of them in a collective way. So I'm going to turn to that now and see what we got. Okay. What's the prognosis for those who get and recover from COVID-19? That is a great question. Obviously, the disease has only been in existence for a few months, so we don't have any evidence that people might not 10 years down the road have some latent effects. We don't have reason to expect that's the case, but obviously you can't rule that out for sure. The question of reinfection is one that is on everyone's mind because there have been some case reports that say people get well and then get it again. That would be atypical but not heard of for a virus, and that will depend on being able to track the possibility of that, and if it happens, how often it happens, will depend on something called serology testing, where we can actually look for antibodies in people's blood and say, you've had it, you're immune, you're not going to get it, and that would be a great test to have in terms of determining who could, operate with impunity and go back and repatriate businesses and be a first responder without worrying about getting infected, if indeed it bears out that reinfection is rare or doesn't happen hardly at all. So that's my hope, and that's a test that's also in the works. So for the most part, it seems like people who recover are going to be just fine. But these are all open questions that could change. Why is the death rate so low in Germany compared to other countries? The death rate is something I'm getting asked about constantly, and I think it also has to do in large part with how places are testing. The number of severe and critical cases in Italy, for example, is extremely high. They also weren't testing widely. It's more than a quarter of cases seem to be critical or severe in Italy, which is, even higher than we've been seeing in other places. So until we have better testing, like widespread screening testing, where you're looking for asymptomatic cases, looking for mild cases out in the community, people who didn't even feel like they needed to see their doctor, we're not going to have total accounting for how, exactly what a fatality rate is looking like. Is it still okay to go out and do a morning jog? Yeah. Even in even in places that are, when you're asked to shelter in place, it is typically still okay to go outside by yourself, practice social distancing, don't get close to anyone, don't touch anything. And it's sort of a measure of keeping people sane in a way that, obviously, if you simply do not move and do not leave your apartment for 3 weeks, that is the surest way to avoid any possible exposure to coronavirus. But that also, of course, invites other health issues, not just from not being social, but your body needs to move. And so that's one of the ways that most places have deemed is still extremely, extremely safe to do, especially if you're going out for exercise, fresh air, relaxing. Those are important parts of trying to make it through this, because it's a difficult time. Is media sensationalizing the outbreak, especially when there's not enough data on the overall affected population? No. No, if anything, most of us have been late to recognize the spread of this. And I think initially the responses to seeing the serious actions taken in China were mostly seen as concerning to people from a human rights perspective. And then later, the World Health Organization is now praising those actions in a way that would suggest that media did not raise alarm quickly enough about the seriousness of this. If anything, I don't have a broad condemnation of anything, because obviously there have been super smart people who've been doing great reporting on this all along. So and I know that the media ecosystem you're consuming sort of really shapes what you think the media has been saying about it. Okay, questions about social distancing. That's my favorite. Can I still go to the house of my introverted friends? Well, if they're introverted, they probably don't want you coming over, right? But if they invite you, how long will we have to social distance? I am thinking about that recommendation like almost any health recommendation, where you more is better. There will be directives in certain areas which are concrete. And then outside of that, there'll be this leeway where you have to exist. You have to find a way to do certain things that are especially important to you. And at points it will be like saying, how much do I have to exercise? Well, yeah, more is better, but there's some subjectivity in there in terms of how much is exactly safe at any given time. And it'll come down ideally to really local recommendations. You shouldn't have to shut down entire countries for long periods. You should be able to, once we have better testing, isolate where the hotspots are happening, where it might be safe to do a little less social distancing, where we need to do more, and try to do it in a way that's sustainable, because we can't just tell everyone stay inside your house for a year and never leave. So we have to be evidence-based and strategic about it, and it all comes back to testing. Do I need to hoard food? You should definitely have enough food that you can self-isolate and quarantine for 2 weeks in place in your home. As far as doing more than that, right now I think the bigger concern is that people might be hoarding food while others need it. If we get to a point where there are areas of the country and ideally the world, that simply the supply chain is shorted out, ideally there'll be global humanitarian efforts to fly in, emergency stockpiles, and I hope that's the level at which we're thinking right now. But you should not be thinking, do I personally need to stockpile, many months of food because global supply chains are going to collapse. I think we have the systems in place to take care of each other if any particular place is hit in that way. Are people with diabetes at higher risk of contracting the virus? Are they also at higher risk of dying? I don't know anything about a higher risk of contracting. That would surprise me if that were the case. But higher risk of dying, I haven't seen it broken down by disease process. It's just kind of generally, if you are in an overall better state of health, you are and younger, you are more likely to have less severe disease. And most of the disease is concentrated much more by age than by general diagnosis, but more severe disease is correlated. So people who are in their 80s and have had a lifelong diabetes, which is in advanced stages, yeah, that would be more of a risk factor. If you're talking about someone who's 30 and has diabetes, I don't think that there's an association there that would make you behave any differently than anyone else. How long do you think this will really last? I'm trying to avoid prognostication, but I think a kind of important point is that, and I should wrap this up. I'm rambling, sorry. That you want this to last a long time. When you talk about flattening that curve, I think a lot of those graphs that you see about flattening it out don't go far enough out. This is a disease that until we have a vaccine will continue to work its way through our population. And if we effectively totally shut down and socially distance in really extreme ways, and it goes through a city and only infects 20% of the people, and then we start to open things up again and everyone goes back out, it's going to hit us again. And then we'll have to go back into, dial it back a little bit, close things again. So it's probably going to be more of a push and pull until your society either gets to a place where most people have had it or where we have a vaccine. And ideally, we do that in a way that doesn't overload the healthcare system too much, and where people who need, we just need to keep in mind that everybody who needs medical care for other issues is still going to need it. The rest of the world isn't going to stop. Most of our healthcare facilities operate something around 90% capacity as it is, and we can defer elective procedures for a while, but we need to keep a careful eye on that capacity for overloading our hospitals. And it's probably going to be a constant push and pull for many months, however long it takes till we get a vaccine. until we feel really confident that we can operate as if this disease didn't exist. I hope that's helpful. I should stop. I'm going to do this again because there are a lot of other great questions here that I would love to get to, and I will look into the ones that I don't know or haven't thought about. But this is really helpful for me. Please read all of my colleagues' work on theatlantic.com, and please listen to our podcast, which is called Social Distance, which we just started at the end of last week, and we're doing every day now. Thank you so much.